Hello, everyone, and welcome back. My name is Adam Cross. I'm a licensed marriage and family therapist in Southern California, the founder of the Catholic Therapy Center. And today I am very excited to be here with a colleague and good friend, Kolbe Young. Today we're going to be talking about really a glimpse of what therapy is like in general, but also specifically with Kolbe. Kolbe, any introductions, anything you want
Yeah.
people to know about you or your practice as a therapist?
Yeah. Well, thanks, Adam, for having me on here and giving me a chance to introduce my approach and what I'm all about here. Hi, everyone. I'm Colby. I'm a holistic trauma therapist. I'm an associate licensed professional clinical counselor here in the state of California. I've been working with Adam at the Catholic Therapy Center, and so just really excited to be here and share more about what we're doing here.
Thanks. So, kind of jumping, well, maybe it's jumping into it, maybe it's not, but why be a therapist? Like maybe I know we've done other podcasts so we can
Yeah.
refer
Yeah.
people to them too, but like short, like, 30
Yeah.
second summary. Why are you a therapist? Why do you
Ooh.
do what you do?
Yeah. Yeah. A little elevator pitch.
Yeah,
Why am
yeah.
I a therapist? Because I'm messed up and we all are, and
Trying to figure it out.
we're
Yeah.
all figuring it out. I'm in the messy middle of life and I love it. I've learned to love it and I help other people love it. I help other people have been there for me and I want to be there for other people. I want to give in the ways that I've received, to put it short and sweet. The Lord's
Awesome.
shown up in my life through other people. I'm a Catholic, I'm a Christian, and gosh, we can profess the faith, we can live it out as best as we can. And there are still areas where we find that the rubber hits the road and we feel stuck in, whether those are experiences or feelings or aspects of the faith that we're trying to integrate. And it's really hard. And so it's really helped me to walk through that with a professional, a therapist, more so than just a spiritual director, but someone who knows the ins and outs of our emotional and psychological movements and how to work through that.
Thanks for sharing that. Yeah. And piggybacking right off of that, why Catholic therapy? Why faith integration? I know you kind of are
Mm,
already talking about it. So it's like, yeah, let's just
love
go
it.
for that too.
Why Catholic integration? Why be a faith informed therapist, a Catholic integrated therapist? Because I can ground my work not only in mutual faith, that if I'm serving clients that are also seeking out a therapist that aligns with their value system, their beliefs, I work with all walks of life, all sorts of individuals, even if they're not Catholic or Christian. My Catholic roots allow me to view every person as holding an inherent dignity and worth, that they have a purpose on this earth, that their suffering has value and meaning beyond themselves, and that who they are as a person, their desires, their longings, their disappointments, their trauma, their wounds, all play a part in the fabric of who they are. And a Catholic understanding of that can really root that, not only in the scriptures and in our Catholic tradition, which is very valuable for those coming to me that are also Catholic, but again, it can really root me in being person centered for any person, any walk of life.
That's great. So, really understanding how to make sense of someone's experiences, but also just who they are as a person. God has created them to be, what healing looks like, what meaning looks like. Why do we suffer? What
Yeah.
happens to
Yeah.
our
Yeah.
experiences? Is it worth something? That's great.
Yeah.
And how does that differ? Like, if I'm going to a Catholic therapist, then does that mean we're praying and reading scripture every session? Or if I don't referred to you as a Catholic therapist, but maybe they're not looking for that integration or they're not even Catholic, how might that vary, client to client?
Yeah, great question. So if you're seeking therapy with me and you're seeking that Catholic integration and you're wondering what that looks like, that is really up to what you need and what you want. And so that's something I'm always assessing for, session to session, moment to moment. What does the person in front of me need? And whether I ask an explicit, direct question about that, or I'm just getting a sense of where are they at emotionally, psychologically, what's coming up? Is the body feeling safe right now to bring prayer in? Or is shame automatically activated due to maybe how a person relates to God emotionally, not just what they say, what they believe, but practically how that's lived out. If there's an emotional response of anxiety or fear or shame or I got to perform, then gently integrating prayer if the person wants that, but also holding space for how do you view yourself and how can this relationship between you and me, therapist and client, even first implicitly being a vessel for how God views you, how God loves and cares for you. And so it's something that's very implicit, but then it can be very explicit as well. So inner healing prayer, we can begin in a prayer, we can end in a prayer, whatever is comfortable. And then also integrating a spiritual figure that the client feels most safe with. So do you like to pray to the Holy Spirit, to God the Father? Who do you relate better to? And that's a great place to start as well. So I like to get that sense and we go from there.
I like how you said that the therapeutic relationship is also a means of healing and examining how somebody relates to God. And that's beautiful on so many levels because therapists really are instruments of the Holy Spirit to accompany others on the journey of healing. God is working through this process, but also through this relationship. God is relationship, right? So it's like what's coming up for someone in the therapy room with their therapist is so important and actually reveals what's on their heart about God and reveals who God is and who God isn't and confusions that might be there, identity lies, or trauma, or wounds to address. There's so much there. That's really cool to keep in mind. Just like the therapeutic relationship does so much in terms of healing. So when you sit down with somebody for the first time and it's a consultation or a therapy session, what do you want them to know about the therapy process? So what's the point? Yeah. What should they expect? Yeah. What do you want them to understand about therapy?
I want them to have an experience that they can walk away with from the very first session, even in the consultation, that this is a safe place to unravel as wide as you need to, just like how Christ stretches his arms out on the cross so then we can unravel within that spiritual container. And it's an emotional container too, for sure, because we feel so much. And so I want them to know that this is a safe place. This is someone they can come to with their disillusionment, with their questions, with their mess, what they don't even know how to hold themselves. We can work through that.
Yeah.
And therapy really is that. It's an area to accompany each other in. And for me to offer some appropriate disclosures of, hey, I get it. I'm also on my own journey. I'm on my own mountain of growth and journeying to heaven and holiness, and you're on your mountain. But having my vantage point from where I stand, my point of view, can help enlighten your walk as well. Because sometimes we're just so tunnel visioned that here I can come in and help accompany you to offer some perspective, some practical tools, but then also a space to have the corrective experiences to heal the deeper wounds that are underlying the surface level symptoms that you're coming in with, the presenting problem, the reason why you came in the door. We can address that, but then also the underlying concerns.
I love that you described like having a safe place. Like that sounds so nice. Just a place to go, someone to be with that you trust, that can help guide you and has that different vantage point and who can help you to figure out whatever it is you're carrying or whatever you're in, just to make sense of it or just to receive it and hear it. And you said unravel. And I know sometimes people are like, I'm trying to go to therapy so I don't unravel. Like, why why do we want to unravel, or why is that good? Because I just immediately heard people are
Great
like, I
question.
don't want that.
What?
Put me
I
back
feel so
together.
out of control.
Yeah, yeah.
Yes. No. Yes and no. We want to unravel in a safe container from a place of regulation. And we don't know how to do that on our own, most of us, especially if we were never taught, especially if we didn't have parents who walked with us through dysregulated emotions. So there's a way to unravel appropriately in a grounded and regulated way. And sometimes in a dysregulated way, because the hope is that we have flexibility in and out of dysregulation. We have flexibility to move into dysregulation and then back into regulation. And what better place to do that than with someone who's trained and equipped to provide the boundaries and the container for that? Often what's felt very unbearable, what's been overwhelming alone, immediately can become easier and not as overwhelming in the presence of a safe other person. And then there's actually a way through in the presence of someone who is equipped with the tools to walk you into the depths of your heart, into the depths of those hidden, banished wounds, and to bring those places of your heart to the table of your psyche, your soul, your mind. So then you can move with more freedom, more agency, more choice, more flexibility when you experience some dysregulation and some chaos. You can more quickly bounce back into a place of balance.
So I'm hearing a safe place to be a mess, or to not be a mess, but to process things, to have that co-regulation, that support, to then be more free, to make decisions and choices, better understanding yourself and your experiences and how you're feeling. The word that you said that I really want to emphasize is containment there, right? Where therapy is.
Yes.
There's a starting point and there's an ending point, and you're not going to therapy for 3 weeks straight, where it's like 45, 50 minutes or an hour and a half, where you're with somebody that you trust in a safe environment and you're feeling how you feel. And maybe that's something good to speak to is, again, like, why would I unravel? Why would I want to feel how I feel? I'm running away from my feelings. Yeah, why should we feel how we feel at all? Why is it good to do that? I guess maybe you're just saying that, but why do that? Why do we enter into that?
Why do we enter into our feelings when our feelings can send us into places that we don't want to be in? We could even see them as causing us to sin. And I get it. There are often a lot of longings, urges, feelings, impulses that are associated with certain behaviors that the church deems as sinful. Yeah. And that we don't like. We see that they're harmful. But underlining the behavior is a good intention, a good desire. And if we can slow down that process from impulse to feeling to action, and we can see that inside of us, there's a part of us that's longing for something good, then we can start to meet that need and that longing in a different way. And it's really looking at that our feelings are morally neutral. They're neither good or bad. It's what we do with those feelings that then carries a moral nature, a moral character to them. And that's in line with what Aquinas puts forth. And so why feel it? A lot of times clients are afraid that they're just going to stay stuck in a feeling, when actually it's not feeling it that keeps them stuck in feeling it. If you can properly be present to an emotion in a grounded way where you're not flooded by the emotion and you're not repressed by it, but you're within your neurological window of tolerance. So it's uncomfortable, but it's safe. And that's a key distinction. Safety doesn't always equate comfort, but we can have safety in the midst of discomfort. So if we can be present to an emotion in a regulated, grounded way, which often takes co-regulation, being with a safe other person, then that emotion, really, you're only going to feel it for about 60 to 90 seconds. That's the average wavelength, let's say, of the arc of how intense we might feel an emotion. And lots of body-based or trauma-informed modalities integrate this, EMDR being one of them, where it helps us maintain attention with an uncomfortable feeling associated with a traumatic memory, so then we can reprocess that memory in a more helpful way.
Yeah. Yeah. That's great. And I loved how you said too that if we actually are running from our emotions, that's where we're likely to feel more controlled by them, to feel more enslaved by them than if we actually feel them. We give ourselves permission to feel them and understand them and process them. And use the example, like, don't think about pink elephants. Right? Stop thinking about pink elephants. Stop, and immediately you get an image of like pink elephants. It's like the more we're trying to tell ourselves like, hey, don't be angry. Don't feel that anger. Don't be upset. It's like, so the more now we are giving our time, energy, and focus to repressing that emotion or that belief or that struggle. So now we're just giving more of ourselves to that, right? And so we're actually fueling the fire rather than in a safe way, and it might be uncomfortable for a time to feel it and for a very short amount of time to let it be there, to unpack it. And that's where transformation happens, right? Then able to operate from a place of peace and make decisions from a place of peace, which is beautiful. And I know you mentioned EMDR, any modalities. If someone's sitting down with you for the first time, they kind of want to know what to expect. What do you like to bring in to sessions? What would they expect?
I'm very person-centered first and foremost, as I also am Christ-centered. I integrate the faith in and through, if that's what a client wants. I also bring in a lot of somatic. Somatic is the Greek word for body. So it's just recognizing that there's a connection between body, mind, and soul. And so the Catholic Church, Christian anthropology has always seen and taught that we are embodied souls, that our souls are not disjointed from our bodies, and that Christ came to redeem the body. Therefore, there's something inherently good in the body. And not just something inherently good, but also prophetic. And John Paul II talks about this in his theology of the body, and there's a lot of resonance there in somatic psychotherapeutic modalities, in that there's a wisdom, there's an intelligence within our body that is very important to tap into, especially for anyone who's healing from trauma, caught in mental loops, struggling with OCD, scrupulosity, anxiety, even depression. It's been my experience that a lot of mood disorders and post-traumatic disorders often benefit from some incorporation of the body in treatment, because what the mind has been trying to make sense of, the body already knows. The body knows where healing needs to go. Often we don't trust our bodies. We don't trust the process. And so not only do we discover more, we find more understanding by actually letting go of trying to make sense, but we also give ourselves the experience of how to start trusting ourselves and trusting God in the midst of the process. So I integrate a lot of somatics. What is that? It's a lot of inquiry into what is the body sensation associated with an emotion or a feeling or a thought that you're having right now. Client is talking about something. How's the body responding? So there's a lot of increasing somatic awareness, or your body intelligence, being aware of what's happening in the body moment to moment. There's a lot of reasons why that's helpful. I won't get into it now. I also incorporate somatic practices as we're reprocessing trauma, memory reconsolidation, and I incorporate that into a lot of parts work, which is another modality I really use, especially pulling from internal family systems, IFS. And that modality really sees us as naturally, innately complex, and that we're not just one state of mind, but that we're a complex, a system of multiple states of mind that carry not just different feelings that want different things or different behaviors, but really subpersonalities within our identity. And it's beautiful to see. I know you and I have talked about how that mirrors the Trinity, multiple persons in one God. and how we have different parts within our self, and that we can really see it as a system. And how, for me, I really incorporate how different parts, we can discover different parts through the body by body inquiry, but then also we can get to know those parts better if we've been relating to them through metaphor, through images, through using our imagination. We can ground that in the present moment by seeing, okay, how does that part relate to a body sense, a body sensation right now? That often has a way of allowing a doorway into deeper trauma work when a client is very caught up in trying to make sense of what's going on, or we're just talking about it. We're talking about a problem in the head, and this facilitates that journey from the head to the heart. The body can be that doorway in this process of healing.
I love that. So I think as Catholics, we can often talk about being body, mind, and soul, but we don't really know what that means in practice. Like, okay, so how do I like really acknowledge my body and just eat well and exercise, but really looking at how those work together, what affects one affects the other. And I've really appreciated that the aspect of the body in my work too, where I'll really ask my clients, like, where are you feeling that anxiety? Like, okay, so you were really socially anxious at this event the other night. Where did you feel that? Where do you feel that right now? And there's always some, oh, it was in my chest. Like, and sometimes it's immediate. It's like, yeah, I was right here. And so just bringing our attention to that, bringing our curiosity to that, and asking, okay, so what does that part of you want you to know? These sub-personalities, sub-parts, that we can also frame it as like these children that need our attention, right? It's an eternal family. It's like, who are these children that need our attention, or who's that protector? Maybe this part of us that feels like kind of a pseudo parent, right? Who has to keep the kids from screaming, right? And so getting to know those parts, imagining these parts of us that have been through and experienced really hard things, have these different roles in our life. So when we get to know those parts relationally and can help them, that's where healing happens, right? That's where freedom happens. We're really bringing the grace of God to these kind of inner children that need the gospel. And so I love hearing that you're integrating that, and this body connection, I think, is so huge. When you're working with people, like, who do you want to work with? Like, who do you work with? Who do you have a calling or a passion to help in therapy?
I've been really enjoying my work with other helpers, other healers, other persons in ministry or healthcare who often give and give and give, but they've never really slowed down enough to receive the same kind of help that they offer others. So that's a space I really enjoy. I also really enjoy working with the intersection between addiction and trauma, and how someone coming in feels really ashamed over some of the things that they've done. And then when we start to peel back the layers, we realize that this addiction or compulsion was a trauma response to unhealed wounds from their past, or even just chronic stress that no one's really taken the time to help them walk through. I also really enjoy working with parents, with teens, with young adults, anyone going through a transition in their life where they get to start taking stock of everything that they've gone through. And then those who are going through the throes of life, they're in the trenches and they're really wrestling with a lot of disappointment and disillusionment, especially with God, with the church, with the faith, because there aren't many safe places to start practicing that within the walls of the church. So my therapy can be a space where we can start working through those questions that it hasn't felt safe enough to start asking. So I really enjoy that. I enjoy watching the process of them work through that, where they create space to allow that ache. And then through that, they start to realize that there's more. But after they've really given the parts of themselves that are aching, that are feeling a lot, that time to get curious about that, to really tend to that, to offer compassion. And then, when appropriate, to offer some direction, practical steps, perspective. How can we make something out of this? What can we do? But we really don't ask what can we do until the very end. So those are some people that I love working with.
That's awesome. What should people know about the commitment for therapy? Because I know sometimes people ask like, hey, can I plan on 6 sessions and then I'll be done? Or is it going to be the rest of my life? What is that commitment level like in starting therapy?
Yeah. And this definitely weaves into my approach and modalities that I weave in. I take a very deep approach. So my work is very relational, very deep. And so that's a longer form. I do offer practical tools, especially nervous system regulation tools, to help provide relief in the midst of the longer process of healing. So there's a way to pace ourselves in the longer process. But I'm not solely solution focused. I'm not solely a relationship or family therapist. I work with families, I work with couples, and I enjoy that work. But I'm very focused on the individual, deep inner process of healing. And you can't rush that. That doesn't mean it's going to take years, but it's going to take most likely longer than 6 sessions. I've worked with clients for a few months. I've worked with clients for coming up on multiple years now. And so it really does look different for everyone.
It can be so personal and subjective, like variable, how long you're working with a therapist, but any type of deeper work requires that self-patience and that time. And it is an investment, right? It's an investment of time, money, even just risk of getting to know your therapist and building that trust. And so there is investment here, but then the fruit is healing, right? Is peace in so many different areas of life, relationships, work, decision-making, vocations, parenting, everything. So it's an investment, but the value is hard to put any firm value to it because it is saying, okay, God, come further in, right? Come further in to these parts of me that I didn't even know. Maybe I was closing the door on God too. And so it's come further in and shining that light. And so there's so much beauty there and hope as people do this work. When someone starts in therapy for you, what's the end goal? Like, what do you want them to take away from the process? I know that's different for everybody, but so maybe main points, like what are you hoping that they're going to take away from it?
Transformation, but that's a very heady, idealistic word. So what does that look like? Peace and joy. More peace and more joy. Yeah, that's it. There you go. But I find that peace shows up when we allow space for every part of ourself to show up non-judgmentally.
Yeah.
And that takes time. And then joy pops up spontaneously in this interaction between all these parts. And that can sound really counterintuitive that, Kolbe, why do I need to feel all my anger and sadness and pain in order to feel joy? Shouldn't I be choosing joy? Well, yes, joy is a choice, but it's also a choice depending on if we have the capacity to choose that. And you have more capacity to choose joy, the more that you have full knowledge of and care and respect for every emotion that you hold and carry, and allow that to move through you, and underneath that, every part of you.
Wow, that's great. So freedom to choose joy. I love that. Mm-hmm. Can I be non-judgmental and accept what is there, what I'm already feeling, what I'm already carrying? Can I accept it? Can I understand it? Can I invite God into it? Can I make meaning? And from that place, can I freely choose joy? Okay, kind of the last question, one of the last questions there. Do you give homework? Like, and if so,
great question.
Any free homework?
That's a great question. It depends on the client. I love if a client wants to do some of their work in between sessions. But I don't want our therapeutic relationship to be one of me being accountable to a pupil or a student. I don't want to be in the shoes of parent or teacher or accountability partner. I'm there as therapist, which can also be distinguished from a spiritual director. If and when a client wants to do some homework, great. Especially in the throes of trauma healing, it's helpful to practice some regulation techniques in between sessions and even leading up to the first session. And so after a consultation, often my clients are really activated and they're struggling to just get a grip on life, just to start slowing down enough, because slowing down is super unsafe. And so I often turn them, anyone that I talk to a free practice that I put together. It's a nervous system regulation practice, and I frame it under what I call incarnational healing, which is really seeing that it can be a prayerful, faith-informed practice, but it's one that is grounded in neuroscience, in the intelligence and the wisdom of the body to allow you the space to mobilize what you need to mobilize and to find rest where you've been really craving relief, but not able to find it yet.
And what, if there's any tools and tips, any way to begin that, or anything you would kind of encourage people to do on their own if they're watching or listening?
You can literally practice closing your eyes right now, listener, and check in, do a quick body scan, head to toe, listening to what Adam and I have been saying. What does that stir up in the body? Do you notice any tightness, any softness, any loosening, any tightening? That's the body responding in some way. Notice how your body's responding. Does your body feel safe listening to what we're talking about? Or does it stir up something that what we're talking about is associated to something unsafe for your body? And that's going to probably enlighten something for you that you didn't know already. You'll probably learn something from just practicing that one technique. And that's also a way to start regulating your nervous system, because instead of trying to control a mental process or figure out whether or not you should work with a therapist at the CTC, you've just started getting curious. So you're in a completely different mode of being right now as you're getting curious with what is your body sensing? How is your body responding to what I'm saying right now? So that's a great tool right there.
I love it. Yeah. So you can start slowing down, listening, being curious with your own body right here and right now. Like even as you're listening to this, you don't have to wait till after.
Right.
You can do it while you're driving. It's just taking that breath.
Yeah.
How am I feeling? What is my body telling me? If I'm tense, what is that connected to? Because your body is not tense for no reason, right? Your body is tense and protecting and preparing for something, right? Carrying something. So what is that? And just that curiosity, that's the beginning of so much fruit, right? Getting curious, childlike mindset, as Christ calls us to. So I love it. Thanks, Kolbe.
Yeah,
That's like,
you're welcome.
That's huge.
Yeah.
Awesome.
Great.
Well, any last thoughts? Anything else coming up as we're talking about all this that you want people to understand about therapy? And then where can they find you? Where can they get in touch with you?
It's a big, big question. Anything else to share with you all? I just like to say that while your body may not feel safe right now, while your mind may not think that you're enough, that the Lord in His goodness knows another truth. What's true in your body, what you're feeling, what you're experiencing is true, is valid. And there's also something else that's also true, and that's the Lord's undying love for you, compassion for you, and mercy for you. And he's inviting you to wonder, what is the next step in listening to the Lord's voice? Is it in prayer? Is it in a journal? Is it in a practice? Is it an accompaniment with a therapist? And so he's just inviting you to wonder that. You clicked on this video for a reason. Maybe you're also looking at who to start working with. Wherever you are in that discernment process, you're right where you need to be. And if it were to work out for you and I to work together, then that's where we can trust the Lord has placed you, and you are enough right where you are today. That the process is enough. You wondering is enough. You wanting even more is enough for today. And how you can get in touch with me, how you can get in touch with me is through many different outlets. You can email me at letsconnect@healingwithkolbe.com. You can reach out through the CTC website. I share articles and resources and share more of my information on there. I also share more of my personal story, resources, and reflections on my website, healingwithkolbe.com. And then I also put stuff out there on Instagram. My Instagram handle is healwithkolbe. I also jump on the CTC podcast with Adam, and we have a great time with our other friends and colleagues on there. So that's great. You can check all that out too.
Thanks, Kolbe. Yeah. And yeah, Kolbe has a ton of great content out there to check out, and videos, articles, all sorts of good stuff. Really, again, helping us to look at our bodies in a new way and in light of the gospel, and bring that into healing with our minds and our souls, right? We are body, mind, and soul. We're meant to look at those intersections and integrate that better. So Kolbe does a great job bringing that home for us and for anybody interested in working with him. So yeah, feel free to reach out to Kolbe, reach out to myself, hit this like and subscribe button somewhere down below, wherever it's at. And if you have any comments or questions, feel free to leave those as well. We love to hear from people. If you have any video suggestions, if you want to hear more from Kolbe or myself on any topics, we love to hear that too. But thank you all for watching today, for tuning in and hearing hopefully a really good glimpse of therapy and healing with Kolbe specifically. And thank you, Kolbe, for doing this work and for just being open to the Holy Spirit to accompany clients on their journeys of healing. But we will see you all next time. Thanks and God bless.